Welcome back to another episode here on the Hard and Hustle podcast. Our next guest, Art, says we're not in it for the paycheck, we're in it for the purpose. So I agree. I think the job that we're doing, Art, whether you're in the healthcare, the nonprofit space, man, it's not all about those paychecks. It's about our cups being filled, man. And that, we didn't even know that our cups were going to be filled. We just started to do things that probably we were saying yes to so many things. We fall into line of something that we really love. We find that passion, we find that purpose. And you spent nearly 30 years now, man, leading healthcare in underserved communities. But it wasn't a career, it was personal. Where does the story begin?
Yeah, I mean, I think for me the realization came actually not too long ago when I kind of really started doing some reflection on where I came from, where it started, what I did, and to me that it was interesting that there was actually a connection to my career to the way I started my life, unbeknownst to me, and I think the story really took shape when I was working on writing a personal statement. And as I was putting that document together, of course, I went to my parents, talked a little bit about, what it was like for them, what it was like growing up, for me as a child, and they shared a story with me that I thought was really impactful that I never heard. And they said to me, at the time that I was born in Long Beach, California, at Long Beach Memorial. But at the time, my parents, Mexican immigrants, they kind of uh, had to work really hard, to kind of get started in their life here in the U.S. And at the time, my mom was actually cleaning houses, as a lot of folks do. And it just so happened that she was cleaning a house for a guy by the name, a physician by the name of Sidney Penn. He and his wife Barbara, and he was a member of the Long Beach Memorial medical staff. And or my mom, of course, had become pretty close with Mrs. Penn. And I think when my mom was pregnant with me, the story she tells me is that one day, she had the baby bump showing and it was progressing, the pregnancy was progressing. And Mrs. Penn asked my mom, so when are you going to deliver? Where are you going to deliver? And my mom said what she should say because, didn't have the best of insurance coverage or any coverage. It was kind of really the county plans. And she said, oh, I'm going to go to LA County, USC County Hospital, like a lot of folks did. And Mrs. Penn said, absolutely not, and said, I'm going to help you and I'm going to talk to my husband because there are a program that not a lot of people know about and there's an opportunity that we think you might be able to benefit from. And so
Yeah.
from that, Dr. Penn was able to help my parents work out a deal and offer them an access to a hospital and a service that they never thought they were going to have. Even though it was in our own community, we lived in Long Beach, but it just didn't happen that way. And it kind of came, full tilt for me as you think about then when I started reflecting on my career. And I said, how interesting that I've dedicated, 28 years now in leadership, specifically in these underserved communities, border communities, trying to get care, the best care possible to individuals. And unbeknownst to me, 51 years before, my parents were able to access a program that was meant for the same thing that not a lot of people knew about. So, yeah.
So looking back, it looks like maybe you feel you chose underserving communities, or maybe purpose chose you. Which one do you think?
Yeah, I think the universe is an interesting place. I think it found me. I think, for whatever reason, all of those things connected to me. And when I started my career, and my career was, a little different. I think when we all, at least for me and my parents, growing up, a lot of the story was we want you to be a doctor or a lawyer or it was kind of in that generation that was the things that they wanted you to do. And I, because my mom grew up later on working in hospitals, and that was where she really spent the last part of her career. I was always around hospitals, and I saw doctors, and I said, "Wow, these are just revered individuals, amazing at what they do." And I thought I was going to go to medical school at one point. And I realized, life happens and things happen, and I took a different path as we tend to do. And I came to the realization one day that I was not going to go to medical school. And so I was still looking for a way to still be able to influence healthcare and be able to hopefully help and do some good, but I didn't know what it was going to be. And unbeknownst to me, I think healthcare leadership ended up offering me that opportunity to influence and support it and do some things around healthcare. And I mean, I'll tell you what, I mean, today I'm blessed because I really do get to influence it on such a larger scale than I could have probably even imagined. And just it's everything. And it all comes full circle. So yeah, I think that purpose found me and it's resonated with me that way.
I'm a big believer that we have all these plans, and God comes and says, "Yeah, yeah, right. This is what you're doing here today, right? And this is where
Absolutely.
we end up, man. And really, as you mentioned, find purpose and find happiness. And then, as you mentioned, kind of really reflecting on your life, then to figure out where you're at today, you're like, damn, it's kind of always been me, and you, sometimes we don't even notice it until. As you mentioned, you had to write this statement, man. Let us know the organization's name. Let us know what the title that you hold, man, and the location.
Yeah, of course. So right now, I'm again incredibly fortunate. I'm the vice president of clinic operations for an organization called San Ysidro Health. We are a federally qualified health center, community health center in San Diego, California, and so we actually span the entire county of San Diego. It's a large county, as you can imagine, tons of people, all types of people too. It's an incredibly diverse area, and so it's we take care of just so many different communities, and so I get a chance to do that. It's the playground that I get to play in is trying to connect people to care that way.
And you guys are serving about 140,000 patients across San Diego. I believe that was the number that I we were able to come up with last time. How do you lead that at scale without losing that human touch?
Wow, man, that's a great question, and I think that's the challenge, right? Because if you think about these organizations, and I'm not talking about federally qualified health centers just for a second, a lot of these are grassroots movements, right? They come out of a need, and the San Ysidro story, by the way, is an amazing story in itself. Because just for a second, this was an organization that started with 7 founding mothers that lived in a community where there was not healthcare, and then they didn't have access to healthcare, and they pulled their community together. They pulled funding, they pulled resources. They reached out to the medical community that was a little further north from here because it looked very different, that many years ago,
Hmm.
55, 56 years ago. And they brought healthcare to their community, and it started in a little house they called the casita, and
Love that,
that
bro.
morphed into what it is today. And I'll share this. Our final founding mother passed unfortunately not too long ago, Mrs. Carmen Martinez. And there's an amazing testimonial video that she kind of did, and they asked her, what did you think about where it is today? And man, tears to your eyes just in terms of the impact and the proud, just the pride that you see emanate from her and some of that. So how do you lead that, right? And how do you do this in a way that doesn't lose the heart and the soul of the organization? Because as you grow, as you go into new communities that maybe don't know you in the way that the southern part of San Diego County knows you, you absolutely have to keep the mission of the organization front and center. You have to make sure that people understand that you're there to take care of. And a lot of that has to do with the people that we choose to work with us, and the people that we bring into this organization, because there are very strong values that we put in front of the organization and the work that we do. So that's how you lead. And whether you're an expansion or you're sometimes there's acquisitions or there's mergers, things that happen that way. It's all about setting that culture and really getting people into the mix when it comes to this is who we are and this is how we're going to work, because they can't lose sight of who we are. At the end of the day, we still have to go back and say we're in the casita. This is my casita in this community. This is my casita in my community. It's about that continuous mission.
I love that, and I'm pretty sure you kind of experiencing that moment where the tears in our eyes and seeing the story of it. Even more grateful to be a part of this organization, right? To know where it starts and to where it's at today, and really your role in it today. Like it's huge, and I can imagine that there's some hard parts you find. Like I would ask, I guess, what's the hardest part of balancing? You talked about the mission with the business reality of primarily Medi-Cal and Medicare populations, because that's kind of the space that you guys are in, correct?
We are, yeah, and I think that's everybody that works in those environments knows that it's a challenging environment. The rates don't change a lot. The reimbursement models. I mean, you're always subject to what's happening, at the federal, the state level with some of that, and you always worry about, are there going to be changes that affect the way you provide care, or the model that you have for care for these intended populations. So it's always a difficult, thing from that standpoint. I'll tell you one of the biggest challenges that we have, and I think this is probably you go across the country and you find this. There's just not never enough. You work really hard to scale your services, to expand your services, to make sure that you can be efficient with your services, because the demand is always going to outgrow your supply. And so we have to find ways to be creative. I kind of joke with people when they say, "Oh, you work in medical environments," and I say, "Yeah, I'm proud to do it because you know what? It forces us to be creative. We have to find ways to stretch that. We have to find ways to really be innovative with how we're going to get to the end goal, which is always how we're going to keep people and make people and help people be healthier through the course of their life, whether they're kids or adults or seniors. You have to find ways to do that, and it could be in a different role, and it could be some cushy deal with you're dealing with certain payers, but nah, this is where it is. This is where I think that you really earn your stripes, and you really kind of set yourself apart if you're able to be successful in these environments.
You talk about creativity and innovation, all that other stuff. I mean, I think we have things that make us a little bit more creative and faster now. We talk about AI, man. How do you see AI playing a role in this space, healthcare? Because for so long, you could probably agree and attest to this, is that healthcare nonprofits, they're kind of behind when it comes to technology and innovating. But I feel like AI is being a little bit more adaptable faster now because people are realizing I can do more of what I love and less of all this, admin and repetitive tasks. I can imagine that you guys are utilizing that. How does that look like for you guys?
Yeah, and that's kind of the next frontier for everybody. And I think, you think about the progression of healthcare over the last, couple decades. We went from paper charts to electronic records to, kind of siloed information to now information sharing platforms. I mean, it really has changed. AI is the next frontier. And I think people today, I think what I'm realizing, and this is even over the course of the last 2 years, if you're not on the AI train right now, you're behind. You're going to get left behind a little bit. And I get it. There's a lot of angst still. Obviously, we grew up in a generation where, AI wasn't necessarily portrayed in the best way, and there's always, a little bit of reluctance there. And so ethical AI ethics in AI is going to be a real big thing as well. But I think that from a way to connect to people and help them expedite, I think it's kind of the next wave of things we have to do. And let's not forget the generations that are in that mode right now. If you think about the X's and the groups that are coming through, we're not, technology, avert. We are, I think, we're in a good position to be able to maximize that. And we're in a position where we also want support and services when we want them. The traditional models of, oh, I need a question, I have a question of this, well, I better make an appointment to go to the clinic. That's really going by the wayside level. So you have to adapt that way. And sometimes, that's where AI, I think, really starts to bridge the gap for you, because sometimes I think, and this is what I've been seeing and hearing, and as I've kind of been involved in some different forums, sometimes what a patient needs or what a person is looking for is just some reassurance or an answer to a question, or something that you maybe don't necessarily need a provider for, or a staff person for. Sometimes you do, and you got to have those abilities to do that. But that's sometimes what we're looking for is, as consumers, as well as as everybody. We want an answer or something in more real time. So AI does that. I think it helps bridge the gap for that. It helps answer some of the things that people would traditionally have to do. But I think the other part is that AI is really going to be the idea that there's an AI assistant for everybody in the organization is something that is a concept that I think blows a lot of people's minds, because whether you're working a front office or you're working, checking patients in as a clinical support person like an MA or an RN, or you're a provider, or even post discharge, AI is going to expand to the point that when you're in the middle of your scope of work and the things that you're responsible for, AI is going to give you suggestions. It's going to help you queue up the things that you do that you normally. It's going to be that partner, if you will. I think that's going to help make your job so much easier and faster. And that's a concept that a lot of folks I think are gravitating to. I think there's people that might be a little reluctant, a little slower in adoption, but I think AI is going to be a great suggestive resource sort of assistant, for everybody.
I'll tell you, kind of to what you said, just being that virtual employee per se, right? And being there when you didn't even know you needed it. I've seen this actually happen in the aviation industry before AI became very prominent as
Yeah.
it is today. And I remember 2, 3 years ago, as I was facilitating in there, start to bring in AI, but they weren't calling it that. But it was that as someone was talking on the phone, it's hearing the conversation and it's already pulling where to find it. It's pulling what to show next. It used to be where we had to go to this knowledge base and, type in the keyword, but now it takes a little longer.
Yeah.
But yeah, man, it is, and it's cool. Like to think, I don't got to go find it. It found it for me. The conversations become a little bit more, just more exciting because you don't have to sit on pause for, well, give me just a moment. I got to wait 2, 3 months. No, it's popping up for you. Like, how much better can it get? And now what I hear though is that people are saying, well, for underserved communities, it's not working, right? That could be, so there's a fear of this tech gap. How do you make sure innovation doesn't leave patients behind when you think about the communities that you serve?
Yeah, and that's something that if you think about, a few years ago, the access to internet service, for instance, was something that everybody was worried about. Not everybody has it. It's not equitable. There's issues there, and there still are pockets, of course, that happens. But I think we have to rely and we have to partner with our legislative groups as well, our teams, to say, look, that is a connection piece. If we don't have those things, that creates these gaps, that creates these chasms that are going to hurt us in the long run when it comes to keeping patients connected. The reality today is that anybody who's part of a health system or health organization, you're going to do more and more things through an electronic means, and so you have to have access to. So we need support, obviously, to make sure that that's happening. From our side, the thing that we have to do, because at the same time, back a few years ago, not everybody had a cell phone. And then not everybody had a smartphone, right?
Hmm.
Today, everybody pretty much has a smartphone, at least the vast, but even patients that are in underserved communities, everybody's going to pull a smartphone out. But we have to help educate them on how to use that, right? How do you actually use the technology that you're investing in to bring benefit to them individually? Because once you tell them, look, you can schedule an appointment this way, you can ask for a medication refill this way, you can send a message to your doctor. You do all these things that I think help maximize the use of the things that they have at their disposal. But I think that's changing and evolving, and I've really seen that movement, I think, in recent years.
So you're saying seniors can adapt because we always hear the opposite of it, that they can't. I'm pretty sure you being in this space, what surprised you most, I guess, about that generational shifts in tech? Because listen, when I talk about the aviation industry, there was times that I was because at one point I was in the phones. That's how I started my career in aviation. And yeah, you'll get your people that were 50, 60 years old and act like they didn't want to adapt, right? Can you help me book my ticket? And I'm sitting here like, I can walk you through it. I'm always one like, let me teach you, let me walk you through it. But some people's like, no, I don't know how to do it. But then I get somebody that's 70, 80 years old that is doing it. So you can't tell me it can't be done when I'm seeing it done, right? And you being in this space, you're probably seeing it done while others are saying they can't do it. What is your thoughts on it?
Yeah, I mean, absolutely, and in the generations, we're getting older. Again, we're not we're more tech savvy, of course, than our grandparents were, and even to some degree our parents. So that evolution by itself is naturally kind of lending itself to a population of seniors, quote unquote, that actually I think is able to do some of the things that are there. So I also, because I've been at this for a while, I do come from a time where I would have physicians say, I'm not using the computer. I'd have people say, I'm not never going to go into the computer. I'm never going to use the system this way. Guess what? You don't have any of that anymore. Everybody moved. So I think that that wave is moving. I think it's going. I think we have to give more credit to really what people can do and what they can learn to do. And I'll tell you, at least speaking for like the San Diego landscape, when you join a health system, again, going back to any of those, it doesn't matter any of the big players that are here in our county. It isn't well, if you'd like to. It's no. It's, oh, by the way, here is your access. Here's your log. Like they connect you right away, and I think that's what sets the stage, right? You have to again help people take that step. So you set the stage for it, and if they need it, you offer the support. I mean, that you can't lose that. You have to keep that so that if they do need it. But today, like I said, with that generational movement that's occurring, those caretakers, guess what? They're me. Those are the people that were taking care of our parents that are in that age. We can absolutely help bridge some of that, and it's going to take everybody. But we're going to get to the point that people are going to say, "I got this." Let me take care of it, kind of thing.
Hey, real quick, if you enjoying the podcast, we first want to say thank you. And we also just want to give you a little insight of what we're up to at Francis. Some don't even realize that we're working with organizations to help them use AI to create that real human communication experiences, where that's actually supporting your families, those patients, or the entire community. We're actually creating tech that connects. Check it out, francis.ai. And it is taking the time to just educate, man. Taking the time to tell people the why behind it, why this is going to be, beneficial for you. I tell you, and I share this story because it's so funny. She's probably maybe mid 40s, maybe late 40s, and I remember asking her, "Hey, do you use ChatGPT?" And she was like, "Oh my God, no! It's I'm not going to use it. I'm against it. X, Y, Z." And I'm saying her like, how could you be? You know what I mean? So I pulled it up and I'm showing her all these fancy things it can do. And she's like, oh my God. 5 minutes later, while we're on this call, she's now sharing her screen and she's, doing ChatGPT. And maybe a week later, she messaged me on LinkedIn. She said, oh my God, thank you so much. Like, I think I'm overusing this. I'm like, there's no way you can overuse it, but I'm happy that you're utilizing it. All because I took the time to show her how to do it and give her the why on how it's going to help her in her space. And a lot of times there's something new comes out and we just don't know how to use it for us. But if you can tell someone how they can use it for them and how it's going to make their life a little bit more convenience, because we all want convenience in our lives. And I think we're in this space because of Amazon and ChatGPT now of the pandemic that we want everything now. We want everything fast. We don't want to have to go work too hard for it. And ChatGPT really gives you that, right? You don't have to think too hard for it, but it allows you to be so creative because it's not like you just use it and it gives you, the output exactly how you want to. You still have to understand it, right? Give it the good prompts, give it the data that it needs. So yeah, there's a lot of education around it, but as you mentioned, I think that we could all do it if we were to just help each other out. Some people just don't like change, I guess, but
Yeah.
like you mentioned, if they don't jump on board, man, they're about to get left behind for sure.
And remember that the pandemic was a huge push forward. Like it nudged people forward, saying, "Hey, guess
100%.
what? You got to get into the telehealth world. You got to do different things." That I think pushed patients in that direction more than anything else. It was just a necessity. You could not do it, kind of thing.
I would even say patience. So I don't know if you know that at Francis we do telehealth, and we have been for 10 plus years. And Keenan and his dad, when early on in telehealth, they were knocking on doors and hearing the no's. It would never be possible. No one would ever do this, right? And so it was even our doctors. It was those leaders in the space. Pandemic happens, and everybody quickly went to telehealth and realized, wait a minute, we can actually serve more people, in our communities via telehealth. Matter of fact, I just had my daughter had like this little rash on the side of her head. I'm still surprised about the telehealth thing, but she had a little rash in her head. We called the doctor right from our home. The doctor sees it. She says, okay, it's a ringworm. We're going to prescribe XYZ. We didn't have to take 30 minutes down the road, man. This was from my home in 20 minutes. Pick up, like, how convenient is that? Like, it's
That,
great.
that's
And
everything.
AI is bringing that too, more convenience and just to be quite honest, I think a better experience overall when you go to see a doctor. Because the number one thing is that we always say is that doctors don't even give us eye contact. Back in the day, we had a family doctor. The doctor knew our family, we knew the doctor. It's not the same anymore. And it's not because they don't want to. It's because the way that healthcare is, you got to take notes, you got to do this, you got to do the other. So it just becomes almost just another number versus no, we're humans. That we want to talk to you, we want you to understand us and give us empathy and compassion. A lot of times we don't see that. I'm pretty sure you know that, right? That's why you see AI being so helpful in this space.
Yeah, absolutely. I mean, it's about regaining some of that connection because the administrative side of what we have to do, it's not getting smaller. I mean, on the contrary, there's more questionnaires, there's more things, more screenings, more things that you have to do. Where's the time with the patient? Where's that
Yeah.
opportunity to connect as a person? And I think that's what AI has been doing. And that's something that we've started here is that AI ambient listening, sort of functionality that allows the provider to when it's consented, set it aside and have a conversation and all of that being captured, in a safe way, in a good way, but then helping them, with the work that they're going to do. And you mentioned the AI and the technology. It's also not just in the medical side. I mean, think about it. I think for me, what's so outstanding and incredible is all of the things that have happened in the behavioral health world, around mental health support, around,
Yeah.
having to use telehealth because that's an area that I think has exploded as a result of all of this. And so you have to do that, not just, and it has an impact, of course, on the patients, but also, believe it or not, from a recruitment standpoint. You know, this isn't the same
Yeah.
world that it was, 10, 15 years ago. People today and medical professionals today, they're asking for a different type of work schedule. They're asking for different types of things. They want that work life balance that everybody talks about. They want to have the ability to do some remote work. I mean, it is absolutely a different. The idea of I'm going to go in and punch the clock, or so quote unquote, 40 hours a week plus, it's just not the same. It's a different
Yeah.
workforce.
And behavior, when you talk about telehealth and the behavioral health space as well, I think it's what's cool is it allows people to really feel comfortable via the telehealth before they even show up in person. And we're seeing that in our younger kids, right? Like we see that they are very comfortable at home in their surroundings, in their environment, to have more of an open conversation versus you meet them in person and their walls are up, right? And you had to work even harder to get that. So no, I love that pandemic changed a lot for us. And of course, in some bad ways, we've had to lose a lot, but I think there was so much that we've also gained from that time on what it looks like to just connect again, and know that there's various ways of connections, especially with our younger generation, man. Think about it. They're not going outside riding scooters and bikes anymore and hanging out that way, man. They're at home on some headsets playing video games. That's how they
I know.
connect
Yep,
nowadays.
yep.
So times have totally changed, man. I would say you really led with a lot of purpose for the last 28 years. What keeps you motivated, man, in such a demanding field as we mentioned a little earlier?
I think for me, it's just understanding that the work's not done. If healthcare is anything, it is absolutely an evolving thing. There's an art form I think to doing this, as opposed to a science. It's going to change. The reimbursement models are going to change. The care delivery models are going to change. The workforce shortages are going to challenge you in different ways. What's covered, 1 year versus the other is going to challenge you. So I think what keeps me motivated is saying, look, the work's not done. The health of our population still can be improved. The ability to reach more people and put people on good pathways to their health, we can still do better. We can do more. And I think that the part that I really enjoyed with San Ysidro is that this is comprehensive, man. This is, not just the medical side of the house. 'Cause sometimes when you work in certain environments, you're only focusing on one thing. Well, here you say, look, the medical is important, but guess what? Oral health is just as important. A person's oral health has a lot to do with their medical health. And oh, by the way, the mental health aspect of being able to continue to live and do things in a way that is meaningful for folks. I mean, it's the whole person you got to take care of in that. I think, one of the things that I read recently, it talks about, the deterioration in people's lives and kind of what are some of the signs and there. When people stop feeling like they can do day-to-day activities that they normally do, when they feel like they're less mobile, less active, less willing to be active, or wanting to engage with people, those are all indicators. We got to treat the whole person, to try to prevent that and diminish that as much as we can and delay that so that people feel like they can, be healthier and live better lives.
I love that you said that, man. And just, I was thinking, speaking to a leader earlier this week out of Seattle, and it was in the real estate space, but realized there was a need around our elderly. So he started to buy property, build these, massive centers. And what he was doing is building community in a sense is how he calls it. And he was like, hey, we made sure that the food that we are serving is organic, is the freshest that's possible, that is gluten free. We make sure we have a gym free of charge for them because I realize if, he's realizing if they eat well, then they're more enticed of wanting to work out. Now they're working out, the mental health is better. They're
Yeah.
realizing now they still got all this energy, right? Now they realize they still got a voice. And he's like, you're starting to see a lot of these elderly because they're being fed well and community, the excitement that they're realizing they still got life within them. And a lot of times it is that. I would tell you, man, when I'm going through it, I always like to work out because something about working out helps with my mental health. Right? You start to feel good, you start to look good, you want to eat good. All that truly does make a difference, man. And people, you talked about oral health. I didn't even recognize that until I got friends that are in the space, and I was like, Efrain, if you're not taking care of your oral, your mouth, like it's going to spread, through your body. And I'm like, yeah, you're right. But no one teaches this stuff.
Yeah.
right? No one is teaching us this. So, and then when you go to these doctors, are they really having these conversations with us like that either? They don't even have time to have these conversations. I'm learning this from people like you and friends that that I'm not being taught at when I go see my doctor for that yearly checkup
Yep.
because it's so quick and out, in and out type stuff. But this is good stuff, man. And I can imagine there's some hard leadership lessons that you've also had to learn. Can you share some about managing maybe that high volume complex care that you're dealing with today?
Yeah, I think the hardest thing that we all face when we're talking about large environments like this is that
Hmm.
it's hard to keep everybody engaged and on board with directions and kind of what you're trying to do when you're especially when you are needing to adapt because of a, let's say, a policy change or something regulatory, something you're trying to do where those individual communities or sites, they feel like they're losing a little bit of who they are. That's a challenging thing. You have to bring everybody on board. You got to do a really good job of explaining the whys. Change management is something that needs to be taught just extensively to people because you have to account for the way people are going to react and the way that people are going to, uh, how they're going to adapt themselves personally to be able to accept new things and new challenges. Um, like I said, healthcare is an evolving, ever-changing environment. I wish we could kind of stay constant and we can do the thing. And at the end of the day, what I realize is that I can't control a lot of that. All we can control is our mission and who we try to be and what we try to do, I think, at the end of the day. So again, it's a difficult environment. I think I'm fortunate that I've been able to be part of it as long as I have, but it's also an environment where there's a lot of turnover at times and there's change and you have to start from scratch again. It's not easy, but man, is it rewarding when you do it right and you kind of work through that. Scale is hard, right? Don't lose who you are, kind of thing.
Correct. And to be quite frank, every healthcare leader has to make choices about where they put their time and energy. Um, can we talk why they should really focus more and consider underserved communities?
Yeah, I think this is, again, more self-realization for me as I've gotten later in my career and I've kind of worked through, the experience. Um, we all go into hopefully our careers with an idea that at the end of the day, it's got to bring reward, right? We all learn about Maslow's hierarchy of needs. These are all things that are kind of, front and center for us in our education. Um, and at the end of the day, it's about what we get from the work outside of the paycheck, right? And what is the value that comes to you? Because I think that for me, underserved communities, the level of appreciation, the level of satisfaction that comes from seeing things improve, from looking at the metrics side of the world where you're kind of evaluating populations that you're trying to serve and you see that movement, right? You see those cancers that were prevented, those great stories where we had a great engagement, or you see diabetes levels getting more under control or hypertension levels. I mean, all of those movements in a population that for whatever reason, a lot of people feel like they don't deserve. Like maybe they're getting a subpar or substandard. Being able to show them differently, I think that's the to me what working in underserved has brought. I go home at the end of the day and I feel like I did good. I feel I'm proud of our team, proud of the efforts. It connects on a personal level that way, that I don't know that I've found it. I would have found in other environments. You know, Not for me anyway.
You kind of lead me into my next question that I'm gonna ask you. You said personal level, so I'm gonna get down personal level with you. I see you're a baseball fan. You got a good baseball analogy for our leaders, man?
I think the one thing that I always tell people is I think it's not over till it's over. So just because you get you're facing a pitcher that's throwing you some crazy curveballs and sinkers and these other crazy pitches that maybe you're not doing well in the first, second, third, fourth innings, it's a 9 inning game.
Yeah.
Don't realize that you still have time to fix things. It's always about maybe you don't get it right the first time, but it's you stay at it. You keep taking your at bats, keep taking your cuts, and guess what? Next thing you know, it might be the ninth inning of the World Series, and you might be coming up to hit a grand slam to win it.
Yeah. Bases loaded. You got a home run. Forget about it. Yeah,
Never
the rest is
know.
history. Are you a big baseball fan? I'm guessing with all the baseball memorabilia behind you and things like that.
Oh yeah, yeah, yeah. I'm a big Dodger fan, which doesn't sit very well in San Diego, but I'm blue through and through.
I see, man. You got the blue on. I'm seeing everything behind you. I'm like, oh no, he's in it. The Dodgers fan for sure, man. Well,
Yeah.
listen, I'm so excited for this conversation, man. And I leave you with this. Actually, before I give you the blind question, where can people find more information about you? Are you on LinkedIn? Are you active on there? But also about the organization, if we can share the website, social medias, and things like that.
Yeah, so as far as San Ysidro Health, it's the only San Ysidro Health in San Diego. So we're SanYsidroHealth.org. I mean, honestly, as far as LinkedIn, I'm on there. I'm on the San Ysidro Health website as well, and so I think there's ways to communicate with us if you need. Yeah, I mean, and I'm always looking to help folks, and so if any questions come up, if you want to pick my brain, or I tell my team here and the managers, and it's a really big group, but I tell them all, look, I'm just another tool in your tool belt. End of the day, all right. I want you to do a good job with what you. It's inherent. It's kind of built in that you do the best job you can. And if I can be part of that, if I can help you, if I can guide you, if I can mentor you, if I can, offer any support that way, that's what I'm here to do. I tell people all the time, like for me, I really feel like I have the easiest job in the world, and people look at me like I'm crazy, and I say no,
That's a good feeling, man. That's a good feeling to have, though.
you don't
And
understand, yeah.
seems like you're an open book, and rightfully so, right? Like everything you learned in life is not for you to die with, is to continue to pour into the next generation. And I'm a big believer in that as well. It's like sometimes I don't know when to shut up because I'm just giving advice, right? But it is truly like, hey, take it or not. I'm sharing this from life experiences. I'm sharing this because I hear so many stories. I mean, when I speak to leaders like yourself, I'm hearing these things from those that are in the spaces. Like, it's nothing that I'm telling you is not real, hasn't happened. It's how do we manage who we are? How do we pour into our kids? How do we pour into the young leaders that are probably right now in the healthcare space that are wanting to take your seat? You're willing to give it up, but just make sure that you have all the tools necessary, and I'm here to provide you with that. So I love it, man. I love that you're just so excited and passionate about it. But I'll leave you this blind question, man. This is a question that I feel you would enjoy. If tomorrow you had to start over outside the healthcare, but still keep that same purpose, where do you take it?
Oh, that's a great question. I don't know specifically what industry, but I know I'd be in the nonprofit world. I know that I'd be looking to do something community wise. I love community advocacy, efforts. I think that's always resonated. There was a time in my life when, I said I was trying to figure out what to do, when I realized I wasn't going to go to medical school. And I considered a lot of things. And whether that was, in the public sector in terms of, some sort of, I don't know, some sort of political thing, but definitely an advocacy part, I think resonates. So, yeah, I think I can't give a specific, but I can tell you that I would absolutely be in a nonprofit. Let's make it happen kind of thing.
Yeah. No, the nonprofit space is one that I think people don't talk about enough. But one thing I love about the nonprofit is usually when you're in it, you get to use all your talents. Like it's not like going into a for-profit where you got hired to do this and that's what we want you to do. The nonprofit is every day is a new day and you get to be creative, you get to put on this hat, this hat, this hat. And it is fun at the end of it all, knowing that what you mentioned, you're helping individuals seek help in ways they've never imagined. Give them resources. Really, why I love to have these conversations is because the resources that we talk about. I'm a big believer that one story, one person can change somebody's life. Look what happened to your mom, right? That just one person, because she
100%.
was able to share her story. And I'm a big believer that when we have these conversations, we could definitely, and not that we would ever know, right? We just plant seeds and hope that they grow and someone waters them. But no, it's a beautiful space to be in a nonprofit. And I'm hoping that young leaders see that. It's not about the money. Continue to talk about it throughout. It's about the passion, about your purpose. It's about the legacy that you leave. We're in here for a very short time. We all were born, we're all gonna die. What do you do in between? You know?
That's what
So
matters.
I love it, man. What is your blind question to the next lady or hard hustle?
I think what I would ask a leader, and I think this is something that I'm curious. I ask this of different people as well. So I think it'd be great to ask them. If you had to narrow it down and you had to pick one principle, one mantra that you keep central in everything you do, that you want to make sure is central for your team? What is it? What is the one thing you got to make sure at the end of the day, it's what you stick to and what you come back to. What is that?
I'm gonna into this for myself because I've heard this recently and it just resonated with what I believe. And it was having faith. Like a faith-led business would teach you more than hustle ever will. And it's just that, right? Like that's that thing is faith, believing in it. You know, especially from the nonprofit space, you have to have faith because when cuts are being funds are being cut and all this, the only thing is faith. We got this. You know, and if we're able to overcome the pandemic, we're able to overcome these moments as well. That's one of the hardest times in our lives. So, now, man, really good question. I appreciate you, Art. Thank you so much for the conversation because you could be doing anything else, but here you're talking to me, man, sharing some insights. So we appreciate it. And guys, if you guys are still watching, make sure that you guys do connect with Art, check out what they're doing in their own communities and things that maybe you didn't know existed. We thank you. And the only thing we ask is that you guys like, share, subscribe. That's how people get to hear these stories and meet so many amazing leaders throughout our country. I've spoken to over hundreds of leaders, believe it or not, Art,
Wow.
just this year alone. Just this year, man. So I feel like I'm just gaining so much knowledge. I gained so much knowledge from you today, and a lot of the times it's just listening to raw, authentic conversations that we can gain so much insight from. So we thank you for being yourself, showing up as the leader that you are, and I can't wait till we talk again and you're telling me all the other amazing things that you're doing. Guys, my name is Efrain. This is Art. We'll catch you guys in the next episode.
Thanks,
Later.
everybody.